listening to Tapped In, Buncombe County's half hour to empower on WRES 100.7 FM in Asheville. Listen up and get tapped into local important resources, information, and topics. Learn more about the topics of today's show at buncombecounty.org. Okay, it's time to get tapped in. Hello, hello, hello to all you beautiful folks in Buncombe County and around. And you know what time it is. It's time to get tapped in. And I am one of your hosts, Zakia Bell Rogers.
And I'm Leonard Jones.
And Leonard and I come to you from the Communications and Public Engagement Department of Buncombe County. Welcome all.
Joining us today is Trish Wallin, Deputy Director for Buncombe County's Economic Service Division, and JeWana McEachin, Executive Director of Asheville Buncombe Institute for Parity Achievement, better known as ABIPA. They are here today to make residents aware of some changes happening to the food and nutrition services, supplemental benefits, and to provide information on some resources to assist residents during this transition, like the Healthy Opportunity Pilot. Welcome, Trisha and JeWana.
Hello, hello. So can you all give us just a little hello of who you are to our audience? Who wants to go first?
Oh, Trish telling me to go first. I'll go first, Trish. My name is JeWana McEachin, and I'm the Executive Director for ABIPA. The long name is the Asheville Buncombe Institute of Parity Achievement, where community health is our thing. We're your community health connection. And in this realm, it's really around health and food, right? And food access. And so we know that food is our entering wedge. We also partner with the county with the community engagement markets,
yes.
Which also is a great supplement to those people that are food insecure. And so we're really excited about talking about what is emerging as resources for people that may be still dealing with these issues.
Yeah. Thank you for having me. I'm Trish Wallin, Deputy Director of Economic Services for Buncombe County Health and Human Services. And again, the food and deserts and different things in our community leave us all trying to figure out how to better serve, and I'm excited to share some information and some upcoming information that I'm not excited to share, just to be clear on that, of some changes that are forthcoming.
Okay, so let's go ahead and start with the hard part first. It's like just snatch the Band-Aid off. Mm-hmm. So Trish, can you fill us in on what's going on with food and nutrition services?
So since April of 2020, our recipients have been receiving an extra amount of benefits in their monthly allotment. And this was part of a plan to manage or help them manage during the pandemic. Some federal changes that have come forward will be taking place in March of 23. So next month, those extra benefits going out will stop. And that will be a very significant change to many, many people. For example, we have a family of 4 during this time receiving a full allotment would have received $939 per month for their allotment. Effective in March, that will change to we will be considering their income and their expenses. That amount will change based on that, and it will. There's not a way to tell you exactly what that will change to, because it will be dependent on the families and the individuals, all those things for them. So everyone's will be slightly different, but it will be a huge change to the many families, not many families, all families that we serve.
Yeah. So my follow-up question around that would be, how are we getting the information out to those who may have benefited during this kind of COVID relief period? How are we getting that information out to those? How will we know who's impacted?
All of our recipients will have been impacted, and currently we have about 38,000 recipients in the county, and so every single one will be impacted because they all were the recipient of the good side of it. Yeah. This will be a challenging side, and is not the information that I would love to share. So to make that point, but it really is, it will be substantial to many, many people, as this is something that they have gotten used to. Food assistance was never intended to be a complete nutritional package for everyone. It was intended as a supplemental program from its origin, and many have recognized that. We've never given people enough benefits to feed themselves all the time. But as we've worked through that with this, particularly in the pandemic, recognizing that there's extra need, hopefully that has been very supportive to people, but now it will be a challenge for folks to go back to that less payment for them.
I know this will definitely affect a lot of our senior citizens. And
Yes.
so a lot of them were getting the like $17 a month. And so what was their pandemic change, and will they go back to that original?
During the pandemic, a person of one for Social Security, SSI folks personally, those seniors that you mention often, they would have been receiving $281 instead of that $16. So in March, it is, yes, they will be back to that regular amount. A household of two would have been $516 during this time, and they'll go back to probably approximately $40 if they were at that $16 for a two. Yeah. So yeah, very challenging for them. We want to make sure we're recognizing our partnering agencies and resources for folks.
Is there anything that residents need to do in terms, do they have to do like go in to requalify, or do they have to come show any more proof of income documentation during this transition, or is it just it's already been set? What can they do to kind of mitigate these?
During the entire time of the pandemic, we have been continuing to do recertifications and asking clients to make sure that they report to us changes in their situation, in their income, in their household size, different things like that. That's a standard for us. We want to make sure that, especially now though, that if they've had a change, that they have told us about it so we can make sure and maximize their benefits. So reaching out and letting their caseworker know of any changes is extremely important at this time.
So, okay, with these changes, we're probably going to see an uptick in the markets and things of that nature. So, JeWana, how are you all supporting that? Are you all hiring more staff or getting more folks out there? What can our community look forward to?
Yes, I cannot say that we are hiring more staff when it comes to the community engagement markets. But again, staff are just there. The community health workers and the navigators are there to be able to help people individualistically about what is their plan if they are being impacted more by the decrease in their funding when it comes to their food stamp assistance or EBT. But then also, what are some other options that are out there? And so I think that may be me tapping in on what we have with Impact Health. And so ABIPA is actually a provider for the Impact Health. And so what is that? And what is the Healthy Opportunities Pilot in Western North Carolina? So let me give you a couple of definitions. So the Healthy Opportunities Pilot is the nation's first comprehensive program to test evidence-based non-medical interventions that are designed to improve the health of Medicaid beneficiaries while reducing their health care costs. So this innovation program is being piloted in 3 regions across the state, including right here in Western North Carolina. So HOP provides support for social needs related to food, housing, transportation, and interpersonal safety. Detailed information on the 29 pilot services can be found on NCDHS website. But Impact Health locally is a WNC-based nonprofit created by Dogwood Health Trust to lead the network of human service organizations providing HOP services, which is Healthy Opportunities, here in Western North Carolina. And so as the network lead, Impact Health Services serves as a bridge between the state, prepaid health plans, and more than 50 human services organizations participating in the pilot. So you can learn more about that also on Impact Health. So what does all of that mean? So if you have managed Medicaid and you are food insecure, you can reach out to your case manager and they can refer you to the HOP pilot. And so if you have managed Medicaid with 4 specific programs, which are Healthy Blue, WellCare, AmeriHealth, Caritas, and United Healthcare. If you have managed Medicaid under those agencies, you can get a referral for healthy food, for a healthy food box. It could be a small box or a large box, depending on the size of your family. And what that means is that you can either pick up or get delivered food to you that has 2 meals for the week. So again, just like we were talking about, it's supplemental. But right now, it seems like we're really going to need some of those supplemental things that really make sure that people are getting whole and fresh food. And so that's where ABIPA comes in as a partner, because our community health workers are supplying some of those needs, and we're in NC Care 360 getting referrals, and we actually are delivering meals to people that are here in Buncombe, Henderson, and as far as Rutherford counties.
Wow.
And we actually have the ability to go further. We need one more truck though. But again, we've gotten really good feedback because of the intentionality of what meals people are getting. They are client choice. So people can say, well, I need a dinner meal or I need a breakfast meal. I'm a vegetarian. And so we shop to provide those boxes in that way that are very curated to what the need is for the family.
So, JeWana, that sounds like some great resources out there. I just wonder, what's some of those eligibility rules again? So, you may have heard everything like, am I eligible? What are those eligibility rules?
I know. So, to be eligible for HOP services, individuals must have Medicaid managed care and live in the Pilot region. So, the Pilot region is Western North Carolina for us. And then also at least one qualifying physical or behavioral health condition and at least one social need related to food, housing, transportation, toxic stress, and or interpersonal safety. So that sounds like it covers a catchment of many people.
Oh, yeah.
And what's important about this is sometimes a child may qualify, and so it benefits the whole family. Mm-hmm. And if more than one person in the family qualifies, you can get more services. Mm-hmm. And so it's really good to know that, one, you do have to have managed Medicaid, so it's not Medicare. Mm-hmm. That's something really important for people to understand when it comes to Medicare, Medicaid. So it is managed Medicaid. And so again, it's really great. And sometimes when we're talking about the social determinants of health, it's really important because we know food is one thing, housing is something, and transportation and all toxic stress. But this is a way that we can really combat all of them in a holistic manner through NC Care 360 because a person can actually get a referral for all those things.
Yeah. All right. Wow, that's a lot.
It is.
That's a lot. Yeah. And so all of you listeners out there, if you have any of those managed Medicaid services, check. It's nothing harmful into just checking to make sure, because sometimes you can find other services as well. And so, Trish, at our agency of economical services, you all are also able to link clients with other information if they come in asking questions.
We are, and we are always happy to do that. And our programs, our standard programs, which are Medicaid, subsidized child care, food assistance, Work First, the energy programs can all be applied for through ePass. Okay. And the email or the address for that is epass.nc.gov. So again, that's epass.nc.gov, and those programs can be applied for there. We very often do those applications in the building. We do them by phone. We try to be an open door policy for how people can apply for any programs with us. But additionally to those are what we would refer to as our standard programs, which are mandated by the state and that sort of thing. We have other services that we always want to share, and currently we're doing the housing assistance program, so emergency housing assistance aid, and we have lots of folks that we are working with in that, trying to keep people in their homes, pay rent and utilities. We also have a program through the CBDG fund, which we are able to assist at times with mortgage payments. So those programs are kind of new to us since the pandemic, but we are serving lots of folks in that area. It very often takes us a minute to get to people because we do have a long list of need in that area, but try to work through those applications as quickly as we can to serve. And then just from the county's perspective, there's also a free tax assistance at local libraries, as it's that time of year. We all know it's tax time. So that is through the local libraries that's available. As well as, I need to give a plug for WIC, which is our Women's and Infants Children's program. We are always happy to try to connect people with that program. It is a great resource and has lost much of the stigma that it used to have connected to the WIC process of checking out the grocery store. Those kinds of things are very different now. So I really want to encourage people to look into that to supplement their food programs as well.
And I think as time has gone on, things have gotten easier. I know during this pandemic time, we have learned so much about there are multiple ways to get one set of information. We're able to telecommunicate, telehealth visits. We're able to do more things online and things of that nature. What are some things that you feel have come out of this situation that has improved your agency?
The state has made some adjustments, and they were originally called waivers at some of the rules that we had in place. For instance, we had to have a hard signature for people who were applying for programs, and now we can take a telephonic signature. That has been a huge game changer for lots of people trying to access services, particularly now. And just some other rules that they've been more flexible on and that we think will remain with us, that will help us serve more people more rapidly. And just moving forward with thinking that, you know, the way we've always done things should not be the way we continue to do things, but to improve and make sure we're reaching out as much as we can. We partner a lot with community agencies and want to make sure we always are sharing information. We answer lots and lots of questions about other resources with our call center and our caseworkers, and we also have those partners very often listed on the buncombecounty.org website. There's also, just to give a plug here again for ePass, there's a link to ePass on the buncombecounty.org website that's on the front screen there to be able to assist in that.
And so, Trish, I just want to elevate again, hearing many of the resources that you mentioned that the county provides out to residents. I just want to highlight ways in which residents can access those again, if you don't mind just running through. I know you talked about the ePass, but if you could just run through different ways that community can access these resources.
I'm happy to. So ePass, of course, they can come to our building if they would like. They can call us and we can do phone applications for most all of our programs. They can email us an application. They can print it off and bring it to us. They can mail it to us by snail mail. They can drop it off in our drop box, complete it, bring it to us. And of course, we are always happy to see people come in the door to sit down and actually talk with our workers. So basically, any way they want it, we are happy to try to connect with them and get it. We don't always have someone immediately available to take a phone application, but routinely that call gets back to them within a couple hours, as we have staff who, that's what they do, is call back and take that information and get that application started. The very fastest way to get an application started, though, is at ePass, because the moment they close that application, it becomes an application for us. Sometimes, you know, we pull something up and start looking at it and are going to get back to it, and we don't. Or we plan to come down to Cox and do an application and it just doesn't align, or we have transportation issues, whatever. But the ePass process is the fastest way to get an application to us.
I also have another question in terms of, I know we talked that there's been a reduction in those services, but is there anywhere where there's going to be elimination for services for people who may have qualified during this allotment during this COVID period that may not have been eligible pre-pandemic?
We are expecting some additional changes back to a couple of things. You all may remember the ABOD clause in food assistance, which is able-bodied adults without dependents. There is a very limited number of months that individuals that fit into that category can receive. We are thinking that that may come back. We are not looking forward to that. And it's still up in the air right now as to when that will happen. But with the ending of the public health emergency on a federal level, we do anticipate there will be a few of those things that personally I'd just soon not come back. But at the same time, we don't have any hard dates on those things yet. Some of our rules that have been giving us a little more flexibility may change, but right now they have not, and so we're embracing it and encourage everyone. You know, we're talking about people and this happening decrease to folks who are already receiving, but I want to make sure that anyone who needs assistance, that need a way to help supplement assistance to feeding their family or themselves, that they reach out to us, because we are eager to serve as many as we possibly can.
Okay, so it's a hard stop in March. There's not a step down or anything in that way. So just to educate folks, how did this become the cutoff? Like, was it a state change and they just said, okay, it's time to do away with COVID funding, even though we're still having some issues with COVID?
No, this actually was a federal change.
Okay, federal
change.
And
it will impact all states, all food assistance recipients in every state. we are not aware of anyone that there's an exception to, and it was federal. Definitely not a local or state rule that went into place. It was passed by the legislatures, and the stop is actually, it ends, the last supplemented month will be this month, February. So March, they will not see it on their cards in March. Another little plug for EBT Edge, a way to keep up with the amount of benefits on their cards. And what we've heard from some folks is that they, during this time, maybe they didn't need all of those benefits, and they've kind of let them sit and store up a little bit. Nothing negative will happen to those benefits. They will continue to be there, and our recipients can look at EBT Edge to see, to check their amounts on there. That's something that we always encourage them to do. And I'm trying to make sure I give you the right.
Oh, it's www.ebtedge.com.
Thank you. I was trying to make sure I got that right.
Yes, I was looking at it as you were going over it. So, which is, it's very nice. Everything now you at the touch of your fingertips, you can look at something instead of having to call and hit an automated system, and is it push 1 or is it push 3, like which one of them I'm supposed to push. But if you can look at it in real time, that's really great. So I love the changes that have been coming, and the growth and the acceptance of technology with the systems these days. So that's nice.
And then I just had a follow-up question around that. Is typically, like, as a community, just being aware, like, when, you know, challenges happen to the whole community, we see it in different places. Like, if you're a teacher, you may see it in the kids. So I know you said that this allotment ends at the end of February. When do people typically receive their services? So, like, I think if things may be stressful, so like everything's going good, and if a certain day you know that this may be impacting the community, you may see a reaction if kids are having an experience at home, if it may show up in our school, or maybe just show up in our church community, or people you just interact with. What are the typical days people mostly receive their services?
So our regular benefits are issued between the 3rd and the 21st of every month. So that the supplemental benefit, most all months have issued on the 22nd of the month. So their normal benefit would go in, and whatever that's been hitting for them that they could see should be the same. It's just that 22nd benefit drop that that will go away. It is based on the last digit of your Social Security number, so it's there's not a predictor for us. Everyone's, of course, is different, but they do deposit during that time frame.
Yeah. JeWana, do you have anything you would like to add?
Well, I just want to make sure that we get back to a couple of talking points in case, because I talk fast, but I want to make sure that everybody gets the general points about healthy opportunities. So there are 3 major points I want to make sure that I go back over. So the Healthy Opportunities Pilot is the first program in the nation to use Medicaid funding to address social determinants of health that can account for up to 80% of health outcomes. Number 2, the pilot's aim is to demonstrate the effectiveness of addressing critical social needs before they contribute to serious and costly medical conditions. And the pilot's success will pave the way for expanding this whole person model of care for more North Carolinians. And then finally, Impact Health is the lead organization overseeing the implementation of HOP in Western North Carolina. And again, that's Healthy Opportunities. And as the network lead, Impact Health serves as a bridge between the state, prepaid health plans, and more than 50 community-based organizations that are providing services across 18 Western North Carolina counties. And ABIPA is one of those 50 community-based organizations. And then also, how can people really see if they qualify? They can visit Impact's Health website at impacthealth.org/HOP or call 828-278-9900. They can also contact their Medicaid care manager, and they can call the member services number on the back of their Medicaid card. And so when you call any of those numbers, you're asking about HOP services in Western North Carolina, because sometimes, you never know who you're going to get on the other side of the line. So we just really want you to be educated about the services that are there, what you can ask for, and how it really is a bridge to make sure that our families are taken care of. And again, if you are enrolled, people can get meals for up to 3 months every week and then it can be renewed according to their need. And so just know that this is really a great supplemental opportunity for people. And since we know that services are ending or being reduced back to normal ranges in March, February is the time that we should really be getting on the phone and on the internet to really see if people apply for, well, not apply, but are eligible for these services. Because again, food is your entering wedge, but it's really going around the social determinants of health, because we've had clients that we've been able to help for the food distribution, but then also helping with move-in assistance, so they can get first month rent, they can get healthy household goods. So they have, depending on the number of rooms they have, we can purchase items like beds, like sheets and things, pots and pans, within whatever budget they're allocated. So just know that there is a lot of wraparound care that is there. And here in Western North Carolina, I say that we are very resource rich. It's just a matter of making sure that people know how to access and know that they have access, to make sure that we're really taken care of.
And so, JeWana, again, just for the listeners here, can you uplift that contact information again?
Yes, of course I can. So again, directly for Impact Health, you can call 828-278-9900. You can also call ABIPA at 828-251-8364. And at those engagement markets, we have community health workers that are already there. And so they also will be equipped with the cards, the RAC cards that have all of the information, just in case you say, okay, JeWana, we heard it, but we need it to be reiterated. So knowing that there is opportunity to really make sure in real time that people are supported.
All right, so we are almost out of time. So I want to give everybody a moment to plug in something they want our listeners to know. So Trish, I'm going to start with you since you started us out.
I just really want the community to know that we realize this will be a hardship, and that we are here to support in any way that we can, and with their partnering agencies in the community, to make sure that folks have access to what they need. We all need to feel like we are appreciated and honored in our community, and just working together to recognize that. So call us, contact us, reach out. E-Pass, again, the fastest way, but our phone number, as many of you might already know, is 828-250-5500, and we look forward to hearing from anyone that we can help in any way.
All right.
And then I just want everybody to remember that Impact Health is really trying to make a great impact with HOP, or Healthy Opportunities. So whether you get plugged in or tapped in, and it's ABIPA, the YMCA of Western North Carolina, Bountiful Cities, Manor, or any of the other HOP providers, you know that we're here for you, and we look forward to serving you.
And I would just like to uplift again the Buncombe County community engagement markets that happen throughout the county. We're at 13 different locations, and you can find out where those locations are on the Buncombe County website under community engagement and its community markets, and you can find our date and times that we're there. We normally have 1 or 2 each week, so we do realize that this hardship may be coming, but we're here to kind of support, as you heard on the radio show today, that there's many resources out there, especially those who may be struggling with some food insecurity, but we're here to support people and give people the dignity and integrity that they need to be to thrive in this community.
Well, all right, I'm going to wrap us up. I want to thank our guests so much for coming and sharing this information with us and caring for our community. Many times we see things as tragedies. We survived a long time with a pandemic. We wore masks, and they were hot in the middle of the summer. We fell in love with them, we fell out of love with them, and we learned a lot about ourselves. This was a great time for growth, emotionally, mentally, and any other way. And if you were like me, physically, because I gained weight. However, we're at another stepping stone in our community, and these benefits are changing. And instead of suffering or being afraid, this is a time that I want to encourage you. There are no stupid questions. There is no ask too big or too small. If you need help, reach out. At the end of the day, we are one Buncombe. We are here to help each other. We are not here to judge each other and say, well, you should have or you didn't. We are here to make sure that the basic needs and rights are met for our community. So reach out and we will reach back. And to all of you, one Buncombe.
Thank you for listening to Tapped In, Buncombe County's half hour to empower, here on WRES 100.7 FM in Asheville. Learn more about today's topics at buncombecounty.org. Otherwise, stay tuned for more great episodes coming up.